Hi, this is Dr. Christy DeSapri, founding physician of Bone and Body Women's Health. I wanted to talk about osteoporosis and the fact that it is certainly not a silent condition. This week, I saw few patients with vertebral or compression fractures of their spine, and this condition leads to significant pain, height loss, mobility concerns, changes in sleep bowel patterns, not to mention all the numerous visits for x-rays, labs, physical therapy. So it got me thinking that we think about osteoporosis as a silent condition without any symptoms. However, we know that actually compression fractures of the spine 2/3 of the time go undiagnosed. It's really important that when you have osteoporosis, you're measured every year on a wall-mounted stadiometer to make sure that your height is about the same. And if it's dropped more than an inch over a year or an inch and a half since your peak height, this is evaluated. Certainly if you have new onset back pain and you have osteoporosis or low bone density, this needs to be evaluated. So we have 33 vertebrae in our spine, from our cervical spine, our thoracic, our lumbar spine, and then our fused sacrum. And so oftentimes fractures of the spine can happen not necessarily from a fall, but from a twist, a turn, and a bend. And in fact, there are 1 million osteoporosis-related vertebral fractures annually, and 1 out of 4 women will have a vertebral fracture, and in fact, 1 out of 2 women, so 50% of women over the age of 80 will have and sustain a compression or vertebral fracture. So it's really important that we get ahead of this because really, again, the patients that I see with compression fractures, they are in significant pain with bending forward. There are, again, pain medications that we use, braces. We talk to our physical therapy and our orthopedic colleagues. Sometimes we even recommend surgery such as kyphoplasty if there's continued pain. So these are really changing, a lot of women's stability, independence, flexibility, freedom. And so really when I see my patients, we want to obviously be very aggressive at treating these fractures, helping regain mobility, pain control, etc. But when we think about the statistics and osteoporosis being painless, it certainly is not. This is a condition we can prevent and we can certainly treat. I hope to see you soon.